Hi, my name is Diamond Vines, and I did my practicum on addressing cervical cancer prevention in Los Angeles County in low-income areas. The place that I did my practicum is at LAC Medical Center in the city of Los Angeles. Next. The objectives of this presentation is to explain to you what is cervical cancer, how could you reduce your risk of getting cervical cancer, the study at LAC Medical Center, statistics, prevention, disparities, screening, and recommendations. Cervical cancer is a cancer that is developed in your uterus and cervix. The primary factor of cervical cancer is an STD called HPV. HPV allows the cervical lining to grow uncontrollably, which leads to some cancers, with cervical cancer being one of them. HPV can be contracted with you having sex with someone that has HPV or coming in contact skin to skin with someone that has HPV. Cervical cancer is a cancer that is highly preventable if you can cure HPV early. Next. The study at LAC is a study that wants to decrease cervical cancer cases in Los Angeles County. This study aims to reduce the prevalence of cervical cancer through increasing screening such as Pap testing and offering and providing HPV vaccination to those who meet the age requirement. By providing this stuff, we first have to provide education to every patient to let them know these are their preventative methods. With our target population being Latina women, in Los Angeles, Latina women lie to be the highest cases of cervical cancer, meaning that if we start at a young age or before they get HPV, providing this education will be very, very vital to their future. Next. The statistics in Los Angeles County lies as Latina and low-income women still remaining as the all-time high. This means that cervical cancer is a serious threat to them. The incidence of cervical cancer is as high as 14.3 per 100,000 Latina women. Cervical cancer ranks the second leading cause of death among California Latina women, accounting of 21% of all deaths. Next. How could you reduce your risk? You can reduce your risk by knowing your partner. If you know your partner, you guys can get tested as much as possible, as far as every month, every 6 months, or every year. Getting tested for STDs are very important, especially with knowing that HPV leads to cervical cancer. Avoid having multiple sex partners is another vital thing to reducing your risk. If you avoid having multiple sex partners, you will know who contracted HPV to you, and that way you guys both can get tested and both can get treated at the same exact time. Using condoms while having intercourse is a very important preventative method as well. Using condoms gives a 99.9% chance of you reducing yourself of getting any particular STD. Having a regular Pap test is also another preventative method. You should also be getting a Pap test every 3 years. Getting the HPV vaccine is also another preventative method if you meet the age requirement, which is 9 to 26 years of age. Next. What is a Pap test? A Pap test is a screening that checks the changes in your cervix. With that, they are sending off your vaginal cells to a lab to make sure that there is no abnormal results in your cervix. With this test, it only takes up to 2 minutes at the doctor's office. Please do not go take this test if you have had sex within 1 to 2 days before your appointment. You also need to make sure that you are not on your monthly cycle or about approaching your monthly cycle before this test. This test is very important to every woman because it not only gives you preventative methods for cervical cancer, but also HPV. Next. In this picture, this is an example of how a Pap test is done. As you can see, the doctor is putting a spectrum in the vagina, which leads to having a swab your cervix to get your vaginal cells to be sent off to a lab. This is a process that you will go through every 3 years to make sure that you are not at risk for cervical cancer. Next. Next we have HPV vaccine. HPV vaccine is one of the most important vaccines that we have as a woman. This vaccine was developed to prevent cervical cancer that is caused by HPV. This vaccine protects you from 4 types of HPV strands that leads to the commonly causes of cervical cancer. This HPV vaccine is given 3 doses. So for the first dose, you will go for each month, and then you will go 4 months for the last shot. This is a duration of 6 months over time. Next. Who should get HPV vaccine? The people that should get HPV vaccine are females that are ages 9 to 26. The vaccine should also be ideally given to those females that have not come in contact with any sexual intercourse. But it is also highly recommended that if you are having sex, that HPV is a vaccine that you should get. Next. The disparities in getting screening is access to proper care, proper screening, lack of education, and no insurance. Next. Access to care. Clinics, hospitals are not close to patients' home, especially those that live in low-income areas. LAC USC Medical Center is located in the city of Los Angeles, but it is far east to where it is not close to everyone that needs care. Not only that, it's not close to everyone, a lot of people do not have health care. So with not having health care, you cannot get the proper preventative methods that you need, such as the vaccine and the Pap testing. With limited service to preventative care, no Pap test or screening or STD screening is done. So therefore, there is a lack of follow-up. Or if some people cases, they have jobs or children where they can't even make it to the hospital to even follow up on their appointments. Sometimes they're only available on the weekends or after hours, which in those access of care are closed. Next. In this graph, it shows the difficulties of accessing care by age. As you can see, the ages 25 through 29 is the most critical for those at that age group accessing care. And follow up behind them is the age group of 30 and 39. So that means that these are just adults, mid-adults, and also those maybe that are in college that do not have health insurance, that are not in their parents' health insurance, or they don't have jobs that provide them with the proper health insurance. Next. This graph shows the difficulty of accessing care by ethnicity. As you can see, Latino women and men are the highest by 31.2% in Los Angeles County. This gives off that all of their race this gives off that most of their race cannot access care simply because maybe something is too far, they don't have the money, or they do not have health insurance. Next is screening. Screening comes with little education on Pap testing, little education about vaccines, or the vaccine might not be in their cultural norm of getting vaccinated, or no follow-up after results are given, no insurance, or not being able to afford the services that they are provided with. Lack of education. Many of those are not aware of what a Pap test is. They're not aware of what HPV is or how it can be contracted to cervical cancer. Health professionals are not properly explaining to patients what a Pap test is or HPV vaccination, or they're not making it mandatory for all of their patients to get it. Many patients are not aware of where to go or how to approach a doctor of getting these preventative methods, or how to protect themselves properly during sex. Next. This slide shows the surveys that were conducted in the study. So this was one of the post-tests that we've done, me and a couple of interns, of the rates of what some of our patients knew about HPV and cervical cancer. So we asked, have you ever heard of HPV? A little over 100 women said they did, but as you can see, some of them said they don't. Has any healthcare professional discussed HPV with you? Many of them said no, and only little said yes. Were you able to know that HPV was a sexually transmitted disease? Many people did not even know what HPV was, and so a lot of them replied no. I asked, have they ever been tested in 1 to 2 years? Most of them said no, and only a little said yes. Did you know that HPV is the primary source of cervical cancer? Most of them did not know that. So most of them replied no, and very, very, very little replied yes. Did you know that Pap smears are another source of early prevention of HPV and cervical cancer? More people knew yes to this preventative method than they did of knowing that primary cancer, HPV was the primary of getting cervical cancer. Did you know that cervical cancer is preventative? Most of them said no, and only little said yes. Next. This survey here was conducted right after all of the education was given in the study. So we asked, did they feel that this education provided to them would be necessary to carry on to give to cervical cancer? Almost 200 people that we conducted the study with said yes. Did you believe that HPV vaccine will decrease cervical cancer? Most of them said yes, and a little bit said no. Being that the rates were so high, we were shocked because most of them were against vaccines. And so by them getting the education provided to them about HPV, they knew that this was a great preventative method. Will you now start getting tested after this education portion? Most of them did say yes. Would you recommend this program to your peers, family, and friends? And most of them did say yes. Next. Here are many of the recommendations that we are given that me and my peers came up with just by conducting the study in the different clinics to know that this will help decrease cervical cancer. We wanted to set up more testing centers on and off site of the hospitals for Pap smear and HPV testing, such as like the STD testing and things like that. We wanted to create more health fairs so that way, those that were not able to come to an appointment or anything of that nature, they will have a place to go, such as a health fair or a site to where they know that this will be available to them. We wanted to provide health education in the hospital schools, such as colleges and high school classes, simply because those are the critical age of getting HPV, so that we know that they are getting the proper education to protect themselves from HPV leading to cervical cancer. We also wanted to create an awareness campaign for cervical cancer and for HPV women so that they can know that we are there to support them and that we are creating awareness to put this to a stop. We also wanted to create a toolkit for hospitals, clinics, schools, and on education provided in this study to enhance the community knowledge of the infection, prevention, and screening of cervical cancer and HPV. We also want to create focus groups at hospitals, clinics, and schools in the surrounding cities so that way they are always knowing that we have support and that we can find them somewhere to get tested and provide them with the proper education to decrease cervical cancer. We also want to have seminars about this matter and bring more healthcare professionals for the point of contact so that many patients will be comfortable to having a point of contact to know if they have questions or if they needed help finding a clinic or anything of that nature. Next. Prevention matters. If we don't start with prevention, then we can never decrease these large cases of cervical cancer. With Pap testing and HPV vaccine, no woman should die from cervical cancer. Thanks.